questions that I get asked from type 2 diabetics is some version of this. Can type 2 diabetes really be reversed? People ask it in different ways. Can it be cured? Will it go away? Can I get rid of it? Can I go back to normal? And underneath of it all are these questions. Is this one question? Am I stuck with this forever? Or is this something that I can do about it? And I understand when people ask that, so I want to address it in this episode, and I'll see you inside. So, when you get diagnosed with diabetes, it can feel like a door just closed behind you. I know that personally, I felt like I was living on an island. You start thinking about medications, complications, finger sticks, food rules, and whether every bite of bread now needs to come with a legal disclaimer. So let's talk about it honestly. For many people with type 2 diabetes can go into remission, but remission is not the same thing as a cure. Now, I personally don't like the word remission because it feels like it's going to come back, maybe not. But reversal is something that is out there too that's being used and thrown around. I want to use the right words here because the words shape expectation. And I don't want to sell you false hope either. I also don't want to steal hope from you. There is a middle place where we will all tell the truth in the medical field and still believe that your body can change. And that's what I want this conversation to be. Now, when I talk about type 2 diabetes remission or reversal, I like to use reversal. I'm not talking about it like someone who's only read the textbook version. I actually lowered my A1C from 8.1 to 5.4. And before anyone imagines that I did that because I'm perfectly disciplined and a wellness nut, now, if you're a wellness nut, you're not really a nut. So please know that it is not what has happened. Okay. I am a mom of six. I'm busy. I have a career and I had a fast food season for a long time. Now, what changed was not that I became perfect. It's far from it. What changed is that I started paying attention and then I started making small choices that help my body in big ways. And that's the part that I really want you to understand. Improvement does not require perfection. It requires enough consistency for your body to actually feel the difference. So let's define what remission is. Okay. The word cure makes it sound like diabetes is gone forever and you will never have to think about it again. And that's just not how type 2 diabetes works. Reversal is a word that people use because it feels hopeful and it feels easier to understand. And I use it a lot because it is the language that real people like to use. But clinically, the better word is remission. An international consensus report published in Diabetes Care defines type 2 diabetes remission as an A1C below 6.5 for at least 3 months without usual glucose lowering medication. Now, that same report also says that people in remission still need ongoing monitoring because high blood sugar can always come back, especially if you start creeping back into those same habits. So, remission means that your numbers are in a non diabetic range without the medication for a period of time. But it does not mean that you never need labs again. You don't get to fall asleep at the wheel. You still have to continue to monitor your blood sugar over the long haul. Okay. And that means that your body's doing better and you want to work every day to keep it that way. I actually like the word remission sometimes because I do understand that it respects both sides of the coin. It says that change is possible and it also says that we still have to pay attention. Now, let's talk about why remission can happen. Type 2 diabetes is not an actual sugar problem. Blood sugar is a number that we see, but underneath that is insulin resistance. And I talk a lot about this. You also have liver stress, pancreas stress, and a muscle storage capacity, inflammation, sleep, stress hormones, medications, genetics, and years of life that's happening in the background. And that sounds like a lot because it is a lot. Okay. Now, this is exactly why blaming people for type 2 diabetes is so annoying to me because shame does not improve insulin signaling. And if it did, we women and men would be metabolically flawless by now because the world has handed out plenty. Okay. Now, one of the best ways to understand remission is to think about pressure. Your body has been carrying too much metabolic pressure for way too long. Okay. Too much glucose coming in way too fast. too much insulin needed way too often, and too much stored fat in places that do not handle it well, with little muscle activity to help clear the glucose, and too much stress and not enough recovery. And the goal is to take the pressure off of the system. When that pressure comes down, the liver can start to respond better to insulin. The pancreas can get some relief and not putting out so much insulin all day long. The muscles can actually take up more glucose and get the insulin working better. And overall, your system is just not working as hard. Now, the liver is supposed to store and release glucose, which is very normal. It helps keep your blood sugar stable in between meals and overnight. The problem is that in insulin resistance, the liver does not listen to insulin well. Insulin is supposed to tell the liver, okay, we have enough glucose in the system, it's time to stop. But when your liver is resistant, it can keep releasing glucose even when the blood sugar is already high. This is one reason fasting blood sugar can be so frustrating. You can go to bed thinking you did everything right during the day, and then you wake up to a number that makes you want to throw the meter out. Have you been there? I know that I absolutely have. Don't throw away your meter and actually get a CGM because I love those. But when liver fat decreases and insulin sensitivity improves, fasting blood sugar often will come with it. And that's a big reason why food changes and weight loss have such a strong effect for some people. Now, this is not about punishment, it's about lowering the workload. And then you have the pancreas, okay? The pancreas is where all the insulin comes from. The beta cell inside the pancreas are the cells that are doing that work. And they can get exhausted over time when they've had to compensate for many years because prediabetes can show up about 10 to 15 years before you're actually having diabetes. And some people, when that metabolic pressure comes down, the beta cell function actually improves. That means the pancreas can start to respond better and more to a normal state after meals. And this is a major part of remission that's possible for some people, especially when you're earlier in the diagnosis. And this is why I care so much about early action, not to panic and not having shame here, just action. If you were diagnosed recently, you're in a good position. You have a really good opportunity to protect those beta cells. Now, if you have been diagnosed for years, I don't want you to leave this episode thinking that it's just too late because it's never too late to improve your blood sugar, to lower your risk of complications, and to overall feel better and just lower the burden on your whole body. The sooner you start paying attention, the better here. Now let's make this practical because nobody wants to leave thinking, wow, what a fascinating liver chat. Still have no idea what to eat, right? The first thing that helps is your food structure. Food and movement are going to be the two biggest things. Now, every diet is not going to be helpful for everyone. Now, I have personally tried keto diet, and in theory, that sounds great because you're not eating any carbs, so less insulin, and it just naturally you just think it's going to get better. Keto for me because I'm predisposed to high cholesterol, it made my cholesterol go super high because I'm eating a lot of cream and cheese and especially red meat or just meat in general, and it has more cholesterol. So I had to stop that before I had a heart attack. So you really have to find something that works for you. Some people do very well with lower carb. Some people do better with a Mediterranean style approach, which is my favorite approach. Some people need a little bit more structured plan for the season or tighter control on their A1C, so they have to really be strict. But the common thread here is that the plan that whatever you choose reduces blood sugar spikes, okay? Whatever plan that you choose. It's supporting your weight loss and it gives your body enough protein and fiber to feel fed and keep you satisfied in between meals. And this is why breakfast matters a lot. A high sugar or high refined breakfast can start the day with a spike. And then you have the crash and more cravings and hunger and then repeating the whole cycle. But a protein for breakfast with fiber can improve your insulin. It gives you a steadier energy and it protects your blood sugar pattern and it helps your insulin work way better. Now, I talked about movement a little bit, and you want to start thinking about moving after meals, okay? After you eat, glucose starts entering the bloodstream after a little bit. You probably have about a 30-minute window to use it, and your muscles can actually help pull that glucose out of the bloodstream and into your muscles to work, okay? All you need is really just 10 minutes. Now, I aim for 30 minutes every day, but I didn't start there. If you're starting from zero and you're not exercising, you don't have that moving lifestyle, then a 10-minute walk is where you want to start. So it doesn't take a long time, flashy, you don't have to join a gym. It's highly effective and realistic to do. Okay. Now, the third thing that you need to be thinking about is building muscle, especially if you are a perimenopausal woman with type 2 diabetes and PCOS. Now it's called PMOS. Muscle is basically a glucose storage tank. And the more active muscles that you have, it means that your body has more places to put that glucose, and it actually helps your insulin work better as well. This is one of the reasons that strength training is so important because it will help overall metabolic health, and it'll help you protect your bones from osteoporosis and just make you stronger as we head into the second part of our lives. Now, I know strength training can sound intimidating, especially if you have not done it. I know when I think about strength training at first, I'm like, I don't want to get bulky and look like some big muscle man. I don't want to do that, but we can start with small weights and really start to build from there. But we are not starting with a bodybuilder plan and a gallon jug of water, okay? So you can just get that image out of your mind. We can just start with squats in a chair, wall push ups, resistance band, or dumbbells, 1 to 2, 5 weights, or carrying groceries. The idea here is starting to build muscle so that we have more muscle mass than fat mass so that our insulin can work better and we can utilize glucose more efficiently. Now, as we're talking about weight, for many people, losing body fat will improve insulin resistance, and it also helps reduce the fat in the liver and the pancreas. And that makes a big difference on how your blood sugar is. But we're not going to talk about weight like it's a character flaw, okay? I cannot stand that, okay? Women, we've been shamed enough about our bodies for decades, and shame has never once helped anyone lose weight. It's never helped anyone's pancreas work better. Weight is a metabolic issue, okay? It's not about your worth. It's not about your identity. It's just one piece of the physiology. If weight loss is a part of your plan, the goal is not to make yourself miserable. The goal is to create a way of eating and moving that lowers insulin resistance. It's protecting your muscle mass and supporting blood sugar, and that's something that can actually fit in your everyday life. Because if the plan makes you hate your life, you will not keep doing it, I promise. And if you can't keep doing it, then it's not going to be a real plan for you. Now, I do want to mention that, and I say this a lot in my socials and articles that I write, but when we talk about insulin resistance, you really need to know your insulin resistance number. So you want to get an insulin panel if you can from your doctor. If not, a lot of times Quest and LabCorp, you can actually order your own labs too. And this is not something that your doctor is checking on a regular basis, but it's an important number because especially when you're just starting out on your health journey, you want to know where are you starting from. So getting that insulin panel will give you an idea where you are starting so that you can tell how insulin resistant you are. If you have a high insulin score, that means that your body's not utilizing the insulin properly, and you want to try to work to get that down because before you can lose weight, the insulin resistance has to start to be reversed. Insulin is a hormone that actually tells your body to hold on to the fat. So it's going to be very frustrating if you're working at eating and improving your diet and then you're working out and then you're not moving on the scale. I know that I've been there myself. I started out with an insulin of 22 and now it's 9 after the lifestyle changes that I've been implementing over the last several years. And so at the beginning, I was frustrated. I didn't even understand what insulin resistance was until I started reading and really understanding what diabetes is all about. And so I don't want you to be there and get frustrated and say, okay, I did all of these things, Stephanie, and nothing is happening to my weight. And this is the main reason why. And you might have to think about getting extra help with insulin resistance, even if it's medication, GLP-1s, metformin, if you have PCOS. But there are lots of other options out there, and you might have to be more strict the higher your insulin number is. Now, I want to talk about medication, and I want to say this clearly because remission conversation can get weird around medication. Medication is not failure, and medication can lower that load on your body while you are building the habits that will carry you through so that you can avoid those complications. Medications like metformin and GLP-1 medications, insulin, and other therapies all have different roles depending on the person. Your medication plan should be between you and your clinician. The goal is not to prove that you're tough enough to avoid these medications. The goal is to protect your body at all costs. You want to avoid those complications, keep your A1C in a good range, lower your blood sugar, And medication may be the safest and smartest bridge while you're working on the food, while you're working on the movement, sleep, and weight and stress. And some people can reduce or stop those medications later with the guidance of your provider. People can continue the medication for life because it's the right tool for them. Either way, you are not failing if you take medication. One of the biggest things that gets people stuck is having a mindset of all or nothing, okay? They hear remission is possible, so they try to overhaul everything at once. New diet, new workout, new you, new supplements, new morning routine, new grocery list, new bedtime, new identity. And for about 4 days, they're unstoppable. And then life happens. A kid gets sick, work gets stressful, you go on vacation, dinner goes sideways, and suddenly the whole plan collapses. Then they say, see, I can't do this. The problem is not them. The problem was the plan was too strict. The plan was too big to survive real life, if we're honest, right? This is where I want you to start smaller and repeat the basics before expanding. A better breakfast, a walk after the meals, adding strength training twice a week, enough blood sugar data to learn your patterns, medication support if you need it, and follow up labs. Sleep improvements where possible. These are the basics, okay? Nobody's going to make dramatic reality show about a woman eating Greek yogurt and taking a 10-minute walk after dinner. It's boring, it's basic, but these are repeatable choices that are going to really change your numbers. Now, if you're working towards remission, you need to know what is changing. Tracking your A1C with your provider every 3 months is a minimum and a must. Watching your fasting blood sugar at a minimum, checking those post-meal numbers sometimes so you know where your blood sugars behave. If you have a CGM, look at those time and range. Look at when your meal spikes happen and some overnight patterns, paying attention to hunger, cravings, your energy level, any waist or dress size changes, your blood sugar, and how you feel overall. Remember that the numbers are not there to shame you, they are there to guide you. And I absolutely love this data because data takes diabetes out of the vague fear cloud and makes it very specific. Once it's specific to you, you can actually do something about it. Here's what I want you to try just for 1 week and then build on that. Okay? Build a remission friendly breakfast. I want you to think about protein first and find your favorite thing that you like to eat. If it's oatmeal, add some protein to that. If it's eggs, make a veggie omelet. Whatever you find that's going to be protein forward, that doesn't mean it doesn't have any carbs, it's just more protein. And make sure you're including fiber, making that added sugar very low and low carbs in the beginning of your day. Then I want you to track what happens. If you use a meter, check fasting blood sugar and check that 2 hour post breakfast number a couple of times this week. If you use your CGM, then look at your breakfast curve and note your energy level afterwards. Okay. I don't want you to change all the things at once. If you change everything at the same time, it'll just overwhelm you and you won't actually know what helps. So I want you to start with breakfast and let your body teach you how your body responded. Now, if you want to add one more thing, take a 10-minute walk after dinner. This is a powerful place to start because dinner is often the meal that creates the biggest glucose problem after you eat, especially as you wind down and get close to bedtime. So, can type 2 diabetes be reversed? The answer is simple. For many people, it can go into remission. Now, remember, that does not mean it's cured forever, but it does mean that your body is capable of responding to changes. When that pressure comes down, your body's not broken, it's just overloaded. And the way forward is not punishment, it's just a simple strategy. Better food structure, more muscle, more post meal movement, and enough data to learn your patterns so that you can make changes specific to you. Now, you might need medication. You might need medication where appropriate, and then always want to follow up with your provider, especially after you start making changes. Now, if you're listening to this and thinking, I want that, but I feel so far away, I want you to start with just one meal. Start with the next meal. Not next year, not next week, not your whole life, just one next meal. Make breakfast work for you tomorrow. Check the number without judging yourself and take a walk if you can. That's how change starts. Not with a perfect life, but with one repeatable step that you can repeat over and over again that tells your body, hey, we're doing things different now. If this episode helped you, send it to the woman who thinks diabetes remission means she has to give up every food she loves and become miserable. She needs to hear that this goal is not misery, it's a strategy. Stay well. Thank you for listening to the Ditching Diabetes. If this episode helped you, make sure you follow the show so you do not miss an episode. And if you want help actually putting this into practice, come join me inside my school community. It's where we take what we talk about here and turn it into real life action, like what to eat, how to understand your blood sugar numbers, and what labs to ask for, and more, all without losing your mind. The link is in the show notes, and I would love to see you on the inside. See you next time.